Hey clinicians, healthcare providers out there, and people who love working with hips. This video is specifically for you, and it's a dynamic test. It's called dynamic FABERs. What you're going to get from this is actually you're going to figure out which people are going to respond really well to rehab versus surgical cases. Now, the theory behind this actually is that I'm only going to use a kettlebell and a strap to really do this test for you. And what we typically find in actually school is that when we have a positive FABERs test, as well as a couple other tests, we start thinking, this person might have internal hip pathology. They might have a labral tear. They might have hip impingement or FAI. They're all definitely possible, but at the same time, are they structural problems that cannot be fixed other than with surgery? Are they going to be very uneventful to rehab, or are they going to really respond really well to rehab? In this test, the dynamic FABERs is one that I really like to use to give a good idea of outcome. I'll explain it first before I actually go into it. Now, let's just say if I was in this position right here, and I had a pinching pain in the front of the hip. Usually, the more narrow you get, and you squat back like this, they're going to feel the pinch right in the hip right there. Now, if I'm dropping back too, there's a possibility that we have this pelvis that rotates forward into an anterior pelvic tilt. This can happen with squatting or deadlifting or sitting into a chair or getting on a toilet or whatever. So what happens is the roof, if you imagine my fingers right here, the roof of the acetabulum actually comes over and it contacts the femur quicker. What we could do in this test, and what we're going to do is we're going to use, imagine my t-shirt here, we're going to pull up. We're pulling up the acetabular rim just slightly to see if it makes a definitive change. If it doesn't, then we know we're working with something a little bit more complicated. If it does, then we know that all we have to do is to get them into a relative neutral or posterior tilt to relieve the tissue so it can self-repair. Because a lot of times, and I know that you're going to agree with me on this, just like a broken bone, you cast the thing up, you don't let it do anything for 8 weeks, and then you realize the bone repaired itself. That's great, right? So, but if you took the thing off and started shimmying it and never give it a chance to repair, it's not going to repair either. So if we unload this tissue, it'll have a chance to repair itself. I'm not an advocate of disuse and not using the thing for a period of time, but we certainly need to unload it. So this is a way to unload and coaching them through that. Now, I'm going to show you first FABERs test, and by the way, I'm going to use this kettlebell just as an anchor point because I usually use a rig or something more solid, but for the sake of this video, it's going to be easier just to have it right here because I have the lighting kit all set up. Now, FABERs test is this and this right here. And if you know anything about FABERs test, we test both sides, obviously, and you want to see if it's pinching or any type of discomfort into the hip right here, but also to the height. A lot of times people will not let it go to get a true test. So we're testing one side. We're going to check the other side, creating discomfort. And actually for me, I had more discomfort on the left side here, which actually makes sense with the case that I have. So here's what I like to do. You can have them do this on their own, or you can do it with them. This is why you shouldn't use a kettlebell. Okay, I'm going to simulate. Get that thing away from me. All right, I usually have them both hands on top right here, and I have them forced into my hand while I'm securing this area just to make sure it doesn't move and they don't go like this. And if it improves, and when they engage the torso right here, or even a partial sit-up sometimes will work, they're lifting that rim up, and it's a really good sign for rehab. Now, if you take this band and it's attached to something way over there that's solid, and they pull this thing down, they're also using their abdominal wall to do that, which then lifts this slightly as well, and they'll say, hey, that feels better. Right? So then we want to make sure that we're on the right track with this, because oftentimes people think this is a coincidence or maybe they warmed up. They like to think they warmed up. So I usually use it as like a switch. I say, okay, well, maybe, yeah. So I'm like, let go of those things. How's that feel? Oh, it came back again. Okay, can we go like this again? And drive it really firm. By the way, they're using about half their effort here. I'm just not because of this. For really firm, and I say, how's that feel? They're like, oh, it went away. And I said, okay, why don't we slowly unramp that tension, slowly unramp to the point where it's half now, or sorry, where it's 0. How's that feel? And they say, oh, it came back. I said, okay, let's drive it again. How's that feel? Oh, it went away. So what we're trying to do here is that, I mean, obviously a test the first or second test is nice enough for me to see, but as I keep going with this, I keep telling the patient, do you see what we're doing here? Do you see what's happening? Because really what it comes down to in the very beginning with patients is recognizing, getting them to recognize and having that inception, that idea that, oh my God, I can control this. There's something I can do. And this is an important step in it, realizing that how they activate different sections of their body or how their posture or their position is really important for the condition that they came in with, even if they thought it was a surgical case. So let them see that. And if you do it over and over and over and over again, how many times is that really coincidence? I mean, right, that's like you flip a coin, like, you know, one time you hit heads or tails, and then you keep flipping, and then like you keep getting different results. It's mixed results. This is the same exact result every single time you see the person, and also multiple times in that first day. Keep trying it. So this is a great test to do that I did not learn in school, which has helped me a ton with rehabbing cases of hip impingement, back pain, radiculopathy, sciatica, whatever you want to call that stuff. Very, very helpful. So I will put more of these on, by the way. If you have questions on this, feel free to reach out to me. I'm in Huntington Beach, California. I do take interns periodically. So if you want to shadow on a day, just let me know and we'll see if we can work it out. I do have products and ebooks and courses coming out for young clinicians in case this was like mind-blowing to you, which I mean it was to me when I learned it. I have courses coming out for you guys which are going to be very affordable, which are going to go over a lot of things like this. I'm going to go over my videos. We're going to patch it all together to make sure that you feel really good when you examine certain regions of the body and certain conditions with people. So check out the video I have for you as well. Check out the link below, and I'll talk to you guys tomorrow.